My name is Emma Scott. I'm a physician assistant here at Parker Cornea, and today I'm going to be walking you through how I do the ICL measurements for our ICL surgery. ICL stands for implantable contact lenses. This is a really great option for high myopes, so patients who have extremely strong prescriptions. It's a really quick surgery, but the prep takes a little longer, so I'll show you what we do. The first part of ICL measurements are taken from the ARC scan. Now, the ARC scan is a machine that's able to take high-frequency ultrasound photos of the anterior segment of the eye. So I will show you now how I take those measurements. So here is a patient that had an ARC scan. The ARC scan takes photos of the eye at different degrees, and so I always use 177, 0, and 3 degrees for my measurements, and then I take the average of those three, which is over here to the right, and that is what I'm going to use going forward. So I'll kind of show you now how I take all these measurements. I'm starting at 177. Click the start button, and first is asking for sulcus to sulcus. So that measurement is going to be from here, and you're just clicking to here. Next is sulcus to sulcus lens rise. So that's going to be from that measurement we just took up to the top of the lens here. Ciliary body inner diameter. These little muscles here. So anterior chamber angle nasal. This one's not as important. I don't use this measurement for much, but I will go ahead and measure this angle here. And then same thing, temporal. Angle to angle is going to be the distance between those two angles that we just made. And then the anterior chamber depth is from the top of the lens to the innermost layer of the cornea. The anterior chamber width is from here to here. And the angle recess to angle recess lens rise is from that line we just made to the top of the lens. So we've completed all of the measurements we need for 177, and now we can switch over to 0 and do the exact same thing. The sulcus is kind of where this harsher white line ends, so it's kind of right there to right there to the top of the lens for the sulcus to sulcus lens rise. Ciliary body inner diameter is a really important measurement that we use for picking lens size. The anterior chamber depth is going to be from the top of the lens to the back of the cornea. It's the inner anterior chamber depth. The width from here to here. And the height. So now I have all these averages of these three measurements, 177, 0, and 3. And these measurements I'm going to record in an Excel sheet. Dr. Jack and I share an Excel sheet of all of the ICLs that we've done, and we have all of their previous measurements in there so we can compare ICL sizes from before and what has worked, what hasn't worked as well. So I'm just going to record all of that. And then I also repeat this for the other eye. So this was the left eye, and I just go back to the patient information and pick the best photo for the right eye and repeat that again for these three images. The other main picture that patients who are getting ICL will get is a Pentacam. So part 2 of me getting measurements come from the Pentacam. So I'll show you which ones I'm going to use now. So there's 2 main displays that I'm going to use for the Pentacam for my ICL measurements. So I'm going to come up here to display, and first I'm going to choose holiday report. The holiday report is going to give me the EKR values that I want. So this is what I will enter into the ordering system for K1 and K2. So for this patient, K1 would be 44.04 at 160 and K2 would be 44.35 at 70. The EKR values we found are very accurate. And then next I'm going to pull up the 4MAPS chamber display, and this is going to give me the rest of the measurements I need from the Pentacam. So obviously here we're looking at the patient's right eye, so I would do this exact same thing for the left eye. One thing we want is the anterior chamber depth internal. So for this patient, it's right at 3.00, which is great. We always want an anterior chamber depth of 3 or greater for the best outcomes for patients. And then I'm also going to come over here to the left, the bottom left corner, and get the white to white, which is 12.1. And I believe it also asks me for the corneal thickness. So the central corneal thickness for this patient is 468. But those are all of the measurements that I take from the Pentacam for both eyes, and then I'm ready to move on to the third step. The third step of ICL calculations is me putting all of those values into this Excel sheet that I share with Dr. Jack. So this has all of the ICLs that we've done before, like the date they were, the eye, what kind of lens power, size we put in the patient's eye. And then we have some notes, of things we've learned over time. But this is just a really nice tool we can use to refer back to. We can see, oh, there was another patient who had very similar measurements and this size ICL worked really well for them. So the values that we've found to be the most telling as to what size ICL we should order have been these right here. We have the anterior chamber depth, the white to white, sulcus to sulcus, sulcus to sulcus lens rise, and ciliary body inner diameter. This one in particular, Dr. Jack thinks is, the most important when determining lens size. So I always make sure to document all of those. And I also write here, sometimes we order 2 different lens sizes and then, so we have a backup. But again, this is just for us to refer back to for future ICLs. So after I've completed the first 3 steps of getting measurements from the ARC scan, from the Pentacam, and entering them all into our Excel sheet and kind of comparing from previous patients that we've worked with, now I'm going to enter all of that information into the ordering system. So the ordering system for our ICLs is Stella Star. This is the kind of layout for the ordering system for Stella Star. They recently changed it. The very first thing that we're going to put in is a manifest refraction. So that's also something that a ICL patient will get when they come for a consultation, is a manifest refraction. And then I always put that in right here. Now, this patient obviously did not need a toric ICL. Their cylinder was 0, but many patients often do need a toric lens. So if their cylinder is above like 125, we'll choose a toric. But here I just have ICL selected. So once I put their refraction in, then I can put in all the biometry numbers. So again, this K1 and axis, K2 and K2 axis are from the Pentacam, as well as this anterior chamber depth, the central corneal thickness, and the white to white. So all of those values I get from the Pentacam. And the whole reason that we use the ARC scan still is because we've just found that we're able to compare it with old ICLs, and it just gives us a little more accurate results. But what's really great about this ordering system is after you put those values in, it gives you a recommended lens. So it gives you a recommended lens size, power, everything. Now, oftentimes we've found that the recommended lens size that it gives us is a little bit on the bigger side. Like for example, this patient is recommending a 13.2. We usually most often like to stay around a 12.6. So that's where all of that previous knowledge that we've gained comes into play. The Excel sheet, we look back and say, oh, someone with similar measurements to this did really great with a 12.6, because we do not want to overvault the patient. And so before I make my selections, I definitely take into account what Stella Star is recommending, but there's one final thing that I like to do to kind of make sure before I choose exactly what lens I want. The fifth and final step for ICL measurements is using the Reinstein calculator. We had the opportunity to have Dr. Reinstein come and visit our clinic a few months ago, and he taught me so much about ICL measurements and the ARC scan. And he actually formulated this amazing calculator that allows you to pick an extremely accurate lens size. So we always use this and compare what Stella Star is recommending to us, what we think based on previous patients, and we compare that to what Dr. Reinstein's calculator is telling us we should use. So here we have the Reinstein calculator. It can be found on ICLsizing.com. At the top, you'll just put in patient details, and then we scroll down and enter all of these values. The first is the lens sphere power. So we get this right eye, left eye from our manifest refraction. Next is the pupil size. This can be found on the Pentacam on 4-MAPS chamber. It has the pupillary diameter for each eye. You can also just check this in clinic. The next few values, so white to white, ACD, internal, those both can be found on the Pentacam as well. And then all the rest of these values are all from the ARC scan. So that just shows again why the ARC scan is so important. After putting all these values in for the right eye and the left eye, you just click calculate. And then this calculator tells you exactly the projected vault based on the 4 different lens sizes. So a 12.1, 12.6, 13.2, and 13.7. You know, I would say on average, we're aiming for a vault of around 500 or greater. So obviously the 12.1 is going to be way too small for this patient because it's giving us a projected vault that's a minus, that's a negative. So the 12.6 is also giving us a pretty small vault. So we're definitely looking at a larger lens size for this patient, either a 13.2 or a 13.7. I always print out this page and add it to the patient's chart just for us to have to refer back to. And so this has just been a very helpful tool, kind of a last step to check our work and make sure we're picking a lens size that's going to give us a desired vault where we're not over vaulting the patient. Another great feature of the Stella Star ordering system is they allow you to order a backup lens for free. So oftentimes if we're kind of between lens sizes, let's say we think the patient needs a 12.6, but maybe they need a 13.2, we'll get the backup lens in a 13.2 just in case. And then whichever lenses we don't use, we just send back, and that's all free of charge. So that's a really nice feature. I hope that you all enjoyed watching this video. If you have any questions, make sure to leave a comment. And thanks so much for watching.